The Deputy Chief Medical Officer has repeatedly referred to the mum test, as in, would you want your mum to have the COVID jab?
My mum is 78, she'll be 79 shortly, and I've already said to her, Mum, make sure when you're called you're ready.
Today, here was Mum, Elizabeth Van Tam, mother of Jonathan, receiving her first dose.
All right, are you ready now? Yeah, sling come in.
But tonight, the head of a large care home group has revealed to Channel 4 News that they have had outbreaks in homes where the residents have received their first vaccine doses.
Currently, we have at least 3 homes where they had the first dose of the vaccine, and almost 100% of the residents had the vaccine, and a large proportion of the staff, where 2 or 3 weeks after the first dose of the vaccine, in one case 3 weeks after the first dose of the vaccine, we now have a number of cases, symptomatic cases, among residents in the home.
None of the vaccines promise 100% coverage, and immunity takes time to build up, depending on which jab they've received. Nevertheless, Mr Calverley has now written to the government asking that care home residents receive their second dose at 3 weeks instead of 12. And today, the Doctors Association has again asked ministers and health officials for more information on why the timings of those doses was changed. Their letter says those who received their first dose prior to the change in schedule had their treatment unilaterally changed, contrary to what they had consented to. They go on, there has been little acknowledgement that those receiving the second dose of the Pfizer vaccine at 12 weeks are essentially being enrolled into a trial.
For the Pfizer vaccine, the data suggests that you have, the first dose, and then between 3 to 4 weeks later, your second dose, and that's what gives you the high levels of immunity. By pushing the second dose to 12 weeks, we just don't have any data to tell us exactly how immune or, how less ill people are going to become, which is a concern.
Government scientists have repeatedly said that their aim is to get as many people as possible vaccinated with the first dose to ensure some protection, though there are disputes over how much protection this actually gives. The vaccine is at the heart of our way out of this crisis, but today hopes that it would lead us out of a lockdown anytime soon would dealt a blow.
I think it's too early to say when we'll be able to lift some of the restrictions. We're seeing the contagiousness of the new variant that we saw arrive just before Christmas. There's no doubt it does spread very fast indeed. It's not more deadly, but it is much more contagious, and the numbers are very great.
And today a group of scientists also published their various scenarios of vaccine uptake and transmission, calling it why vaccination of the most vulnerable does not guarantee an early end to the pandemic.
If we were to lift everything before the summer, I think we would see a very big and very bad impact on hospitals and on mortality as well.
Despite the vaccine rollout?
The vaccine rollout will take time, and so even by the summer, I think it's unlikely that we will have everybody in the UK being offered 2 doses.
The next review of England's lockdown is on February the 15th. But the numbers remain grim. The REACT study, which looks at transmission outside hospitals, appears to show infections are not declining. And the numbers of those infected aged over 65, for instance, have doubled since early December.
Well, joining me now is Professor of Virology at University College London, Dina Pillay, who's a member of the Independent SAGE Committee of Leading Scientists, and Professor Devi Sridhar is Chair of Global Public Health at Edinburgh University. Professor Pillay, first, should the government now reconsider its advice on the second dose? Has it made a mistake?
Well, what we've heard just now is that there have been cases in care homes within 3 weeks of the first dose of vaccine. We've got to remember that the trials did actually base themselves on for Pfizer vaccine 1 dose and the second dose 3 weeks later. And so I do think we've got to be cautious in our interpretation of these data, because it may be that infections happened within the period of time that we know that individuals are not protected. So I think there is a danger of overinterpreting this, but we've got to remember that we're living at a level of extraordinarily high levels of infection, and therefore all of the necessary measures need to be taken to deal with this infection. Vaccine is not a one-off, single silver bullet.
I mean, care home residents will, for the most part, be getting the Oxford vaccine rather than the Pfizer vaccine. And so they're not sort of defying manufacturers' instructions to that extent there. But what does the more transmissible nature of this virus do to that calculation? You know, is it the case that our care home residents are not being protected as much as they could be?
Well, of course, you're right, is that the vaccines were trialed, both the Pfizer vaccine and the AstraZeneca vaccine were trialed in environments where the circulating virus was known to be susceptible to these vaccines. Now we have a different variant, which may not only be more transmissible, but may have some sort of level of resistance to these vaccines. We don't know that. There's a lot of work going on. But I say it again, is that the important thing is to maintain trust in the vaccination program, whilst at the same time recognizing that while there are high level of circulating virus, there will always be some risk to individuals. And therefore, I would ask about these cases, these outbreaks in care homes. I'm concerned that we're losing the effectiveness, what effectiveness did exist for test and trace and social distancing.
Professor Sridhar, what is the sensible way for the government to assess whether it's doing the right thing?
Well, I think right now we need to look at the position we're in, which is a deep pit. We have the NHS under severe pressure, burnout, workforce exhaustion. We're having thousands of deaths. We have a vaccine, which we know has pretty good effectiveness. And also we have an economy shut down and massive, economic concerns. So I think right now we need a phased way out of this, which is get a strategy, get a plan. Do we want to look like Australia, like New Zealand, like South Korea, Hong Kong, Singapore? Then we need to trade off and do what they've done. We can get back our daily lives. We can get case numbers down. But the trade-off is we're going to have a pretty robust test, trace, isolate scheme, and we need travel restrictions. So that's the cost. So I think right now we need an honest debate, from the Prime Minister, from ministers saying, this is where we could get to. This is the cost for each of us, which will be international mobility. But that means hopefully by next time this year, we can all be back to some kind of daily life, of normal life.
But Conservative MPs are tonight calling for restrictions to start being lifted on March the 8th. Now, if the REACT study published this morning showing that infections aren't coming down despite lockdown is correct, I mean, can we even contemplate that?
Well, I think it's because there's concerns about lockdown, and everyone knows the harms of lockdown, right? As we know the harms of schools being closed, but that doesn't help you reopen schools if we have substantial transmission. So I think right now they're seeing the problem, but they're not seeing the solution, which is lifting things in March just means we'll be in a lockdown in April. It's that simple. It's easy to lift restrictions. It's hard to stay out of them. And the vaccine, to get to any kind of herd immunity, we need 80 to 90% of the population covered. So I think instead of just saying lift restrictions, which is an easy thing to do, we need to think, how do we avoid getting into another lockdown and more people being infected, which means a comprehensive suppression strategy and things we're not doing right now. And isolation, for example, we need to be giving people, I would say, 80% of their salary, like a furlough payment, to not go out and infect others. They can stay home and isolate.
Is there a danger, though, that, I mean, people are going to start decoupling infection rates from lockdown decisions because the key thing is the death rate. And if you've vaccinated all the vulnerable people, then the death rate will fall. And so, you'll have a decoupling of the figures from the policy.
Yes, that seems intuitive at the start, but what's getting us is not the death rate. What's getting us is two things. The first is the hospitalization rate, which is the NHS under pressure, because then no one can get the care they need if you have a heart attack or a road traffic accident. And that's also younger people in their 40s and 50s. A lot of the ICU beds are people under 60. Secondly, long COVID, the morbidity. We don't know the exact prevalence, but it's substantial. Are we ready to have a virus go through a younger population and children, which means at a population level, you have a certain percentage who will be ill for months? That's a huge risk, and I don't think that's one that right now we want to take.